Tye is a really active boy. He likes to surf and hike and mountain bike and downhill ski and you name it.
It's hard to look at Tye Varnes and appreciate that just 8 weeks earlier, he underwent major surgery to repair a heart defect.
I took Tye and his younger sister Cora for a regular physical checkup. Tye was up, and I had noticed that the doctor spent a little more time listening to his chest and his heart than with Cora. And he basically said to me, he says, "I'm hearing something I'm not quite sure about." He suggested to just make sure, get an appointment with a cardiologist and have them check out exactly what this is.
Tye's presentation to my pediatric cardiology clinic became something less than a routine visit when I noted that his blood pressures were very high, and on physical examination, the pulses in his lower extremities were not palpable. When you have high blood pressures in the arm and absent blood pressures in the leg, your first concern is that a patient may have coarctation of the aorta. Coarctation of the aorta is basically a cinch in the large blood vessel that provides blood flow to the body. And in Tye's case, the absence of pulses in his lower extremities suggested that there was a significant narrowing, not allowing blood to flow easily across the aortic arch into the thoracic aorta. And at that time, I talked with the father and recommended that I review the structure and function of Tye's heart by doing a pediatric echocardiogram.
Tye went through the echocardiogram. I was there the whole time with him. And when he was finished, the doctor came in, looked at it while Tye was still there, and asked Tye to leave and go get some candy in the front room. And at that moment, I shivered internally, and I was concerned about what was about to come. And she said, "I'm about to tell you something you don't want to hear."
Tye and his parents were referred to Dr. Michael Black, a cardiovascular surgeon at California Pacific Medical Center.
Tye, when first examined, presented with some of the symptoms that are classical for this problem. He was complaining that his legs felt very heavy and numb, and it's not uncommon, although Tye didn't report it, to have headaches because the blood pressure is so high in the cerebrovascular or the head vessels that they're pounding all the time, especially during anxiety or exercise.
Each year, about 35,000 babies in the U.S. are born with a form of congenital heart defect. These heart defects are the most common birth defect and account for the majority of deaths of children under 15 years of age, excluding accidental death.
We'd hear a story here and there about somebody, one of our friends, whoever, maybe a kid with leukemia or somebody else who's dealing with some kind of an issue, and we always used to think, and I always used to think, wow, it's got to be tough. In a nanosecond, we became one of those parents.
Once I had explained to Mr. Varnes that Tye's diagnosis of coarctation of the aorta would require a surgical intervention, I reassured him that the team at CPMC has a long history of caring for children with congenital heart disease.
The staff, that the medical nurse and the anesthesiologist and Dr. Black, they were all so, I could tell they knew what they were doing, and they were so relaxed, and they were all totally competent. Nobody seemed nervous, and so that helped me not feel nervous.
Using minimally invasive thoracoscopic techniques, Dr. Black was able to do the surgery through a single miniaturized incision between Tye's ribs. This technique allows for less cutting, less tissue damage, and ultimately less pain, and a faster recovery.
Tye's condition, the coarctation, presented a narrowing in the aorta that was very, very small, but when we opened it, the internal lumen was less than 2 millimeters, and that's smaller than a baby weighing probably 1.5 pounds. I mean, most babies that are born would have a main artery measuring 4 or 5 millimeters. His was 2, and he's lived with that for over a decade.
Everybody smile.
His repair went very well. He was discharged from hospital very quickly. But it's very important to follow him for the rest of his life. The expected sort of result from this surgery would be that he would have no further operations over his lifetime. There's about a 10% chance that whatever I've sewn together won't heal right, and it's possible he'll need a little balloon to stretch things open.
Tye's recovery, from my point of view, went from more severe than I thought it would be to seeming like he's better, completely better in 3 days. It was amazing that he was able to recover so quickly.
Before the surgery, my legs, they were like cold, and they would usually hurt when I would like use them a lot. It's changed. I feel a lot stronger when I like hike, and I'm tempted to run all the time, and I just feel a lot better. I'm looking forward to going back to like being really active and running and feeling the big difference in my body.
The American Heart Association is being critical in assisting physicians such as myself, a surgeon, in not only having a new armamentarium of diagnostic studies such as the MRI and CT, new drugs available, and new techniques and equipment available to make surgeries such as Tye better, but it also lets us communicate about kind of our stories, because there's not 1,000 of these children in one community. So we share our experiences amongst the country and across the world to sort of accumulate what is the best treatment for these patients, what medicine should they have after such a repair. So it's imperative that the American Heart Association continue to fund research into all of our endeavors and to assist us in really making these patients and my patients' lives much better.
California Pacific Medical Center is recognized as a specially certified primary stroke center and chest pain center, and is an American Stroke Association Gold Get With the Guidelines provider. At California Pacific Medical Center, we are proud to partner with the American Heart Association in delivering on their mission, building healthier lives free of cardiovascular disease and stroke.
I would just like to thank Dr. Black and the American Heart Association for having like this successful surgery and helping me heal and feel better.